Okay, so it's 1 minute past 2. Vasudha, are you happy for us to make a start?
Yes, yeah.
Okay.
That's it.
So, okay, welcome everybody on behalf of Public Health and everybody here, and certainly our guest speakers today. And I think this is the third webinar in the series. Is that correct, Vasudha?
Fourth one.
Fourth webinar in the series.
Yeah.
Gosh, they're flying by. Okay, and
Yeah.
this one is covering the real challenge of food poverty. We have 3 speakers today, including myself, and I'll be talking about Food Poverty Core Group that's established in Birmingham. We have Amit Titani, this is the Assistant Director from the Active Wellbeing Service, and he will be talking about community food work. We've got Richard Snyder, who's the Area Manager for the Trussel Trust as well. Just a matter of housekeeping, please stay muted and turn off your camera during this webinar if you can. Please use the chat function to ask questions, and we will answer the questions at the end of the presentation. If we can answer them sooner, we'll try to, but normally we wait until the end. And we will have quite a few people online that can assist in answering those questions too. And today's webinar, as all of the other webinars, will be recorded and it will be shared on the Healthy Brum YouTube channel to make it available to those who can't attend today, and also to those people that might want to review or recap on any of the content that they've heard. So as we've outlined already just in a brief introduction, I will be doing a presentation on food poverty, specifically the Food Poverty Core Group in Birmingham. Amit from the Active Wellbeing Society will be talking about the Food Justice Network and the work of the Active Wellbeing Society. And Richard Snyder from the Trussel Trust will be talking about the state of hunger. Okay, next slide, please, Vasudha.
Thank you, Kyle. That's that much I have got. And then now you can start your presentation, and
Okay.
I'll stop sharing. Thank you.
Thank you. So I will just share my screen. Hang on 1 second. Okay. Sorry about that. I thought it started at the very beginning. Okay, so everybody can see that. So I just wanted to give an overview of the Food Poverty Core Group that's established in Birmingham. And the Food Poverty Core Group is it's actually a subgroup of the Financial Inclusion Partnership, and I have put a hyperlink in there for you so that you can actually find out more about the Financial Inclusion Partnership itself and the strategy. The strategy that I can see runs until 2020, and we are in 2021, so that strategy will be under a refresh as far as I'm aware. But the key principles of that strategy, even though it runs to 2020, haven't changed. It's still with reference to tackling food poverty. The purpose of the actual Food Poverty Core Group is to work together to develop a food poverty strategic action plan in partnership with key cross-sector multi-agency partners. What that really means is that we're looking at a co-produced piece of work. It's not all about the City Council, it's not all about the NHS or primary care or third sector or voluntary private sector, etc. It's actually about the joint efforts of everybody coming together to actually achieve what we can and what we should be doing, which will be outlined in these slides. The group also feeds into the Health and Wellbeing Board's Creating a Healthy Food City aims and objectives and vision, which I'll go through in a short while. And the crux of that is to aim to improve access to healthy food and to tackle health inequalities associated with the lack of healthy food options and routinely healthy food options as well. So I just wanted to talk a little bit about the Birmingham Financial Inclusion Partnership, so you've got some context as to where the actual food poverty group sits. So the vision of the Birmingham Financial Inclusion Partnership is, as stated there, to create opportunities for Birmingham citizens to improve their financial well-being and digital skills so that they can lead healthy and fulfilling lives. And that's not dissimilar really to the vision at the bottom of that slide, which is the vision of the Birmingham Health and Wellbeing Board and the Creating a Healthier City strategy, which is in draft at the moment. And that vision is, as stated, our shared vision is to create a healthier city where every citizen at every stage of their life in all communities can make healthy choices that are affordable, sustainable and desirable to support them to achieve their potential for a happy, healthy life. And you can see where that resonates with food straight away, and you can see where it certainly resonates with food poverty and how we look to tackle food poverty as well. And the aims of the Financial Inclusion Partnership and the purpose is very, very clear. As a partnership, they want to bring opportunities to citizens in Birmingham, regardless of their start in life or their situation. So it's about being equitable and equal. And we will look to test and trial different approaches to meet the changing needs of citizens over a lifetime. So it is actually going across the life course, which is very important. Addressing inequalities and building a set of common standards into our activities that will raise consistency and quality of service provision. And underpinning all of that as well is sustainability. So it's actually about looking at sustainable opportunities so that we can actually move people out of poverty and into more stable opportunities. So I'll move on. This is actually a infographic taken from the draft health and wellbeing strategy for Birmingham. And I've put this in here so that you can actually see that one of the key 5 areas is healthy and affordable food. And you can see that that's underpinned by closing the gap, which is the purple arrow in the circle. And that's with reference to closing the gap in inequality across the city. If we just go back now to the food poverty core group. So the food poverty core group has a set of overarching objectives. And the first one is to deliver a joint vision for addressing food poverty in the city and to exploit opportunities for joint working. So it's actually about knitting together as many of those opportunities across as many organisations as possible, but for the right reasons. It's not about designing yet another vision for something else. It's actually about taking things like the vision for the Financial Inclusion Partnership and the vision for things like the Health and Wellbeing Board and the vision for other organisations and seeing how we can actually joint work across all of them for a common purpose. So that we can actually achieve more quite often with less. It's also to develop a strategy and a strategic action plan that will lead to a sustainable set of outcomes and benefits. And I'll go on to those in a short while because the food poverty group for the city is actually going through a process whereby it will actually be starting to do that and unpick what a strategy and a strategic action plan looks like. The next one is to promote and facilitate coordination between partners and partnerships and to consider what agendas and resources might be shared more effectively where appropriate. And again, that is about co-production. We can't achieve things on our own. We can achieve some things on our own, but not everything. And certainly if we want to achieve the aspirations of those 2 visions that we saw earlier on in one of the first slides, then we do need to work together. We also, as a food poverty core group, report to the Financial Inclusion Partnership and the Creating a Healthy Food City Forum. So you can actually see that there is a structure to it. So it's not a standalone group. It actually is underpinned by its vision and its aims and objectives. But those aims and objectives, as I've already stated, are shared. And they do feed into the Creating a Healthy Food City Forum, which is a subgroup of the Health and Wellbeing Board for Birmingham. The next thing is to promote communication and engagement with the stakeholders and residents of Birmingham relating to the food poverty agenda. So it's actually about getting the information out there and the opportunities that are actually out there for not just stakeholders and providers, but also the recipients, the very people that we're trying to serve and the very people that we're trying to assist in improving their health and well-being and their outcomes. And then the final one is to promote best practice and sharing of ideas, including collaboration that lead to maximisation of things like external funding opportunities. And that's part and parcel of these webinars as well. We're sharing our ideas and we're working in a collaborative way. And we have other people today that are going to be talking from other organisations. And I'm pleased to say that we are working with the other organisations in the context of external funding opportunities as well. The next slide looks at the food, the actual aims and objectives of the group. And I won't
Sorry, Kyle, can I interrupt? Can we make the slide bigger, please? The whole screen, if at all?
It should be. If somebody can tell me what to click on, then I can do that. But as far as I was aware, it should already be maximised.
Don't worry then, don't worry.
That's not the case. Let's have a look. No.
No problem.
Sorry about that.
That's fine. It's okay.
Okay. I mean, are they readable?
Yes. Yeah.
Okay.
Yeah.
Okay. So I will read through them then, just in case anybody can't see them properly. The actual principles that underpin the food poverty group are as follows. Number one is to embrace the aims and objectives of the group. The second one is to consult and or inform the group over organisational changes, including any changes in representation that may impact on collective working. So in other words, what we actually need are people within the group who can make decisions on behalf of their organisation, so we can actually move things forward, so that we can actually work to a set of outcomes, and we don't end up as just a group that talks a lot about doing stuff and not a lot gets done. So it is actually important that we have the right people around the table at all times that can actually make those decisions on behalf of their organisation. It's to follow and work within the performance management framework agreed by the partners. The bottom line is that's just the terms of reference and the aims and objectives that we've actually set out already. Lead the food poverty agenda through promoting and driving service transformation and improvement within respective services and organisations, and we'll hear some fantastic examples of that from Amit and Richard in a short while. Report on progress on mutually agreed actions, and where we report those mutually agreed actions is to the Financial Inclusion Partnership and also to the Health and Wellbeing Board. And both of those groups are chaired by cabinet members as well for the city. So the governance structure is really, really strong there. And to share relevant information and promote collaborative work and innovative work as well, which you would expect, to be honest. I don't think any of those principles will come as a surprise to anybody with reference to this type of group, but it's worth knowing that they are the principles that we actually operate to and we don't deviate from. So just to actually underpin the work of the group, we actually look at three things. We look at prevent, survive, and recover. So prevention, I'm really pleased to say, is actually about identifying and tackling the root causes. And that starts to get into the wider determinants of the reasons why people find themselves in food poverty, because food poverty can often be a proxy indicator for other things that are going on. Quite often people who are in food poverty will also be in fuel poverty and vice versa. But they're proxy indicators for often the wider determinants of health and well-being. For example, one of the most meaningful things we can do is to assist people in moving up the socio-economic gradient. And one of the best things that we can do there is to assist people into meaningful employment. So it is actually about looking at those things as well. And it's about looking at the bigger picture. So the next thing is survive. And that is about the day-to-day work, really, because people are in crisis every day in this city, and that's not unique to just Birmingham. That is shared across the country, unfortunately. So, as an example, we're in a global pandemic at the moment, and it does actually say there, when difficulty or disaster strikes, ensure that there is an appropriate crisis support, and that's very timely because, again, we'll hear from Amit and we'll hear from Richard in a short while. And I'm sure they will touch upon some of that in the context of COVID and what's actually happened and what infrastructure has been in place. And then citizens know how and are motivated to access support. And that's about tackling not just equality, but also equity. It's not good enough that we just have services actually in the city. What we actually need is the ability for people to be able to access them. Just because a service is there doesn't mean that it's accessible. So it's actually about looking at that and ensuring that people at that time in their life when they need it, can access what they need to. And then recovery as well. So the recovery part is ensuring that people are plugged into the right advice, the right information, the right education and support to enable long-term change. And that includes healthy behaviours, but also resilience as well, and sustainability. So it's actually about trying to break that cycle. So what we're actually looking at are three things. First of all is to prevent people from having to either engage with the survive or the recover aspects of this model. Secondly, if they do need to, that we can get them the right help and the right advice and guidance when they need it in a very timely fashion. And thirdly is to work with them so that they hopefully don't have to go back full circle into the survival bit. And that's critical, to be honest. And that's underpinned, as you can see on the right hand side, it's enabled by policy, strategy, collaboration and action. So I'll just move on to the final slide. So I wanted to keep this really succinct. These are the next steps for the group and the main aims. And these are only things we were discussing yesterday and we're actually moving on already. What we want to do is shape a joint vision for the city that includes the lived experience of people. It's really, really important that we actually understand in a very granular way what's actually going on in people's lives, and to actually understand what we can and we should be doing to actually really impact on the prevent, survive and recover agenda. So it's very, very important that we gain insight from the communities that we're trying to represent, and we continue to do that as well. It's not just a snapshot, it's actually in real time. The second thing is to understand the system that we already have and where it needs to shift to. And what we mean by that is the city does have some very great opportunities. And again, we'll hear some of those in a short while from the other presenters. We know that there's a lot going on. Some of it is disjointed, and we know that we don't fully understand the system that we have, and we don't understand therefore how we can ensure that we have equal and equitable access to it. So it's about maximizing what we already have and what opportunities we have in the city for those people that need it most first. It's also about identifying where the gaps are and where that system needs to shift to, and not just move to and shift to, but how it needs to grow and how it needs to extend, and also how it then needs to become sustainable as well. And the third thing is to actually step into the lives and the areas of those people most in need, to assist in building resilience and sustainability in a universal yet proportionate way. So what we actually want is a system which has very, very far-reaching opportunities for people to engage, but also a system that has the interfaces to enable people to be able to engage as well when they need to. And they're the three things that actually underpin the work of the Food Poverty Forum in Birmingham. So I'm going to leave it there, and I'm going to pass over to my colleague Amit from the Active Wellbeing Society. Is that okay? I'm going to stop sharing my screen. Okay, Amit? I think you're on mute.
Thanks very much, Kyle. I think hopefully I'm sharing. Can you all see that? Hopefully has that filled the screen?
Yep.
Wonderful. Thank you very much for inviting me. So my name is Amit Titani. I'm the Assistant Director of Community Food at the Active Wellbeing Society. Here at the Active Wellbeing Society, we believe people should live with dignity and the agency to make decisions about their lives, including the food they eat. Currently in the city, we're overseeing the distribution of 15 tonnes of food, surplus food each week to vulnerable residents across the city in the form of food parcels. We've been doing this for over a year now with partners across the city. Work is essential, but it must run in parallel with systemic change and addressing the inequalities in our city, which obviously Carl was alluding to in his presentation as well. But firstly, just to talk a little bit about the Active Wellbeing Society and what we were doing before the pandemic, to kind of put into context the sort of the changes that were made at our end. So we were delivering a lot of activities in parks and open spaces, trying to connect people with physical activity and with cycling through Big Birmingham bike schemes, so getting more people cycling, and building social connection and cohesion by empowering residents to make decisions about the areas that they live in. And through our work, we were kind of obviously contacting a lot of people across the city, and we're already beginning to see increasing levels of poverty. We knew a lot of the people that we supported were in really difficult situations and often having to make decisions about whether they're able to eat a meal or eat 3 meals a day or heat their homes. Access to food and hunger was often a barrier to participation. So we would often take our mobile catering van, which we use alongside our network of cafes, to sessions as a way to engage people and to support people. In Birmingham, where more than 40% of the population of our city live in the areas of highest deprivation nationally. This was all before the pandemic, and then obviously last year happened and things got worse for many people who were already struggling. So a lot of service provision and support disappeared almost overnight. So a lot of food banks were forced to close and many new ones opened. Vulnerable people were told to not leave their homes, and some of the support services that people were accessing in person obviously became inaccessible for obvious reasons. So we had to make some decisions as an organisation, and we reconfigured and focused on kind of 3 main areas. Food support, which I'll go into, Listen and Connect, which is our telephone befriending service, supporting people who are feeling increasingly isolated, and our ongoing virtual wellbeing offer through our social media channels. During the first week of lockdown, we worked with organisations across the city, and we all collectively helped to set up Brum Together, #BrumTogether, which was a collaboration of over 85 organisations joining up, as Carl mentioned in the last presentation, the need to provide a coordinated approach to support, and particularly to crisis support. So this was a response to that last year. 85 organisations, charities, mutual aid groups. We set up some very responsive WhatsApp groups that we were all on, so we could support each other with resources, including volunteers, food, logistics support, transportation, and we were able to start to respond to requests and increasing requests that we're seeing daily for food. We also worked with Birmingham City Council as the Active Wellbeing Society to set up a central distribution hub, which was in Digbeth, and it's moved around a few times since then, but we're back there at the moment. And that hub was used to receive large amounts of food, which we delivered out to vulnerable residents across the city, again, in the form of food parcels, whilst also supporting organisations with larger amounts of bulk food as well. Just to talk a bit about some of the numbers, so this is from March to March. We supported 43,000 households to receive a food parcel. Those food parcels were delivered to people's doors, and all of that was done through the amazing support of volunteers. We worked with 1,300 volunteers across the last year who provided a combined total of 25,000 hours, which was incredible and essential. Couldn't have been done without those volunteers. We also worked with nearly 2,000, we also provided nearly 2,000 bulk food orders. So we regularly work with about 80 organisations across the city, food banks and various organisations, supporting people with food parcels who would come and collect larger amounts of food. And that was really important because it enabled support to go into bits of the city that a centralised service couldn't. These are organisations that have already got networks with communities in the city, so that was really crucial. We also had a network of cafes which ran before the pandemic, called the Big Feed, which we set up with some amazing support from what was the Real Junk Food Project, now called Incredible Surplus. And we transformed that service into a takeaway service, as many hot food providers did. We cook hot meals every day. We still continue to do so and gave them out for free. We cooked a whopping 35,000 meals in the last year. All of that food was made by surplus food from supermarkets that we've been collecting every week, week in, week out. So yeah, every day our chefs in the kitchens, it was like ready, steady, cook, not knowing what was coming in. We estimate we've helped to sort and redistribute as a network 933 tons of food across the city to people who need it most. In addition, we've also supported over 2,000 people with clothing as well, as kind of that need was arising. And what was the data telling us? So there's some figures from our food distribution over the last year. So 43% of the people that we were getting food parcels to were from BAME communities, 43% were people living on their own, and 91% were from quintiles 1 and 2, so the most deprived, classed as the most deprived 40% in the country. And it's worth just reflecting on that 91% figure, so because our offer to residents was universal. We didn't means test. We didn't require residents to fit specific criteria to qualify for support. The approach we took was if people were saying they needed food, they needed food. And yet still the support found its way to areas that needed it most. And actually, when you compare it to the city average there of 79%, it's sort of proportionate universalism in action. So in essence, ensuring additional resources going to areas that needs it the most. That's what the data was telling us. What people were telling us. So we had a central telephone service, which is still active, where people would call for various bits of support, including food parcels. And it will be no surprise, the top reason why people were needing food parcels, over 70% of people who came to us did so because they didn't have enough income. It's various issues closely followed by delays in benefits and benefit changes, which is, I'm sure, reflected in Rich's presentation from the Trussel Trust as well. So lack of income, benefits delays, and changes to benefits as well. We worked quite hard to provide referrals to partner organisations across the city, including the City Council, to help maximise income and help to secure an additional £354,000 for residents across the city. Here are a few comments that we heard, so I'll let you just kind of read those. They kind of, there's definitely a pattern emerging from this, waiting for universal credit to come through, losing a 0 hours contract. A lot of the people that we were supporting were already skipping meals or reducing portion sizes, who lost a few hours here and there, and then kind of needed this support. We're hearing stories all the time, week in, week out, of people who've gone days without food. We had a lady who was 7 months pregnant who hadn't had food in her house for 2 days. Someone in their 90s who'd come home from hospital to find there was no food. And through our service, if we got a call before 3 p.m, we'd have a food parcel delivered to their door the next day. So Brum together created this opportunity to ensure this joined up approach and ensuring food was getting to where it needed to get to. And it kind of was born out of that immediate response to the crisis and the need to, as I say, coordinate kind of food provision. But it became more about food justice as time went on, and is actually now rebranded as the Food Justice Network. So the Food Justice Network it's grown from the initial 85 or so organisations to over 200 across the city, working together in a joined up way. This includes food banks, includes faith groups, includes schools, includes academics, individuals, anyone with an interest, community gardeners. And we all work together looking at, yes, kind of coordinating emergency food, but also other things such as food growing and land use, the coordination of street feeding activities, hot food provision. It's a really interesting network. See there, the power of the collective. Equal weight is given to all views, and it is sort of a collective democracy. So everyone has the same voice, whether it's through our lively WhatsApp groups where we're quickly responding to need, or through the Food Justice Network meetings. We've got various subgroups that sit under the Food Justice Network, so hot food provision, street feeding, etc., campaigning, and each of those are sort of chaired by various different individuals and organisations. And you can see there our mission is to ensure that all citizens in Birmingham have access to affordable, nutritious food. The work that kind of has been done and the statistics that I showed previously would have been completely impossible without that network, and it is that network that delivered all of that. On the right hand side, you can kind of see some of that network, and actually what that is a map of food provision and intel on food provision as we know it as a food justice network, and that includes food banks, pantries, hot food provision. It's probably only scratching the surface of what there is available in the city, but I'm more than happy to share that to anyone who would like a copy. It's always useful when supporting people to be able to see what support's already out there. So I mentioned the Food Justice Network has done a lot of work around campaigning, and just to kind of touch upon a couple of the campaigns that we've been working on as a network. We've been spearheading the Birmingham branch of the Right to Food campaign. So the Right to Food campaign aims to make all new legislation and existing legislation subject to consideration of an individual's right to food. So an example of that in practice could be the current 5-week wait for your first universal credit payment. And actually, if the right to food was enshrined in law, that 5-week wait could be measured against the risk to someone experiencing food poverty. So that's where it could actually start to influence policy. And we're asking Birmingham City Council to join cities such as Liverpool to put pressure on central government to put the right to food into the national food strategy that's being developed. Other campaigns that we follow is very much centred on the cash first approach that you'll hear about from a colleague, Rich. So that's to empower people to access the food that they want by topping up incomes rather than subsidising them with food parcels. So what's next for us? So circling back to my comments at the beginning, we've been distributing 15 tonnes of food every week. That works out as between 3,000 to 3,500 food parcels a week going to individuals, either via direct delivery from volunteers, and we're always struggling to ensure we've got enough volunteers in to do that. So please do get in touch if you're interested to help out. But also a lot of that's delivered through other organisations as well. That supply of food is ending at the end of June, so it's now tapering down. The numbers of people that we're supporting is at a stable level now from tracking it every week. It is at about kind of 3,000 to 3,500, and that need remains. So as that food runs out, those people will likely go to other food banks, and many food banks in the city have been coming to us for food supply. So it's going to become quite difficult in the city, really, if it wasn't already. And obviously, we know kind of the end of furlough is coming up as well. We're obviously, as we're going to, as a network and as an organisation, continue to amplify the voices of people who can't afford food. We know poverty is multifaceted, and as Kyle was talking about in his presentation, the key is looking at the root causes rather than sticking plasters. And we can't look at a one-size-fits-all approach. It needs a person-centred approach, meeting people where they're at and working with other organisations. And food parcels are meeting an immediate need, and they are essential right now for people who need them, but longer-term solutions grounded in systemic change is needed, along with a change of hearts and minds as well. And I feel more people need to know what's happening in the city. So what can you do? Well, you could join the Food Justice Network. It's open to anyone. We meet every 6 weeks, but we have various subgroup meetings in between as well. Be part of the conversation through the overarching WhatsApp groups as well. I'll pop my email address in the chat, so if you're interested, just get in touch. Signpost individuals you're working with to services available. Richard will talk about the Trussel Trust campaigns and various ways that you could put your voice to really good use. And one of those ways is also signing the Birmingham, the local Right to Food campaign, which, as I say, puts pressure on central government to ensure the right to food is enshrined in law. Look forward to any questions later. As I say, I'll put my email address in the chat. And that's me. So I'll stop sharing now and I'll hand over to Rich Schneider from the Trussel Trust.
Brill, thank you for that, Amit. Always good to hear about the amazing work of both TORS and sort of the wider Food Justice Network. Just get my slides up for you. Hopefully those have gone full screen for you there. Brilliant. So yeah, lovely to be here today to speak to you. So my name is Richard Schneider and I'm an area manager with the Trussel Trust. So just to recap, in case people aren't familiar with Trussel Trust, we as a charity support a network of approximately 1,500 food bank centres across the UK. The food bank centres provide 3-day emergency food parcels, although in reality it's quite often more than 3 days worth of food held within the parcels. The network's supported by sort of approximately 28,000 volunteers pre-pandemic. That has dropped during the pandemic due to general sort of restrictions, etc. But the likelihood is that will jump back up again as we are able to engage people and have them involved more. And alongside providing that immediate crisis support of a food parcel, we also, or food banks in the network, provide a great deal of signposting or referral support and increasingly having services delivered in-house to try and get people the support to prevent them needing further emergency food in the future. So I'm mainly going to focus on a new report we've got out called State of Hunger, but just briefly to touch on some statistics. So the Trussel Trust network nationally between April 20 and March 21 gave out just over 2.5 million food parcels. This represented a 33% increase on the year before. Vast majority of these, as you'd expect, were in England with just under 2.1 million, which was a 41% increase. And 250,000 of those were in the West Midlands. And then from with that number, 50,000, just north of 50,000 of those were in Birmingham itself. So overall, that represents a 33% increase on food parcels given out in the previous year. But when you delve into that slightly, you see that it was a 24% increase for parcels given to adults, actually a 49% increase given to children. So as I get into some of the report, you'll see that is sort of reflected in what we've seen across the country. It's also really key whenever I mention these sort of stats, just to highlight these are only from, it's only count parcels distributed from food banks within the Trussel network. So that's 16 food bank centres in Birmingham. So it really is just the tip of the iceberg compared to what's been going on out there. So just wanted to include this slide because while it is obviously very important to talk about the impact of the pandemic, it's also equally important to remember that food bank usage has been increasing year on year for a very long time. And while the pandemic's clearly exacerbated the situation, it hasn't caused it. So we've actually seen a 128% increase in need over the past 5 years. And you know, this need's been with us long before the pandemic and will be with us long after, unfortunately. So just have to keep that in mind when we're talking about the impact of the last year. So main focus today is just to briefly run through the findings of a recently released report called State of Hunger. So this is an independent piece of research funded by Trussel, but carried out by Heriot-Watt University, and it kind of uses a range of methods to get an in-depth understanding of a picture of hunger across the UK, with sort of a lack of a national measure around sort of food poverty and food insecurity. This is a really important report in sort of giving us an idea of what the national trends are showing us. So firstly, looking at the profile of need for food banks. Before the pandemic, the picture was largely similar to a previous State of Hunger report we released in 2019, where people most at risk are those living alone or single parents. See some of the sort of top level stats just on the slide there. But in this report, it was the first time we actually measured the rates of disability as well. And we found that 62% of working age people referred to food banks in early 2020 were disabled. And during the pandemic, the risk factors generally stayed the same. People who needed support for food banks before the pandemic continued to need support during, but there were a few notable changes which are worth just picking up. So what changed during the pandemic? Key factors there, that there was a significant increase in the proportion of people estimated to have no recourse to public funds. So that jumped from 2 to 11%. There was an increase in the proportion of people aged sort of 25 to 44, so a group more likely to be in employment, and therefore affected by the sort of economic side of the pandemic. There's been an increase in the proportion of couples with children. Previously it would have been a lot of single parents using, but we've increasingly seen family units having to sort of rely on support from food banks, and also a really significant increase in the proportion of people reporting mental health problems, as that jumped from 51 to 72%. So huge change on that particular factor. So then if we're thinking about why do people need support from food banks, ultimately, across the research, one thing stands out, and that is a fundamental lack of income. Our report showed that sort of 95% of people accessing food banks are destitute. So we use the Joseph Rowntree Foundation definition of destitution, and that's just quite simply that people can't afford two or more of the essentials in life. So food, shelter, heating, lighting, appropriate clothing, and basic toiletries. And that's a trend we've been seeing for a number of years. We found that the average income for people referred to food banks was 13% of national average, and that 86% of people were in receipt of social security. So in early 2020, people at our food banks on average had about £248 per month left after housing costs to cover bills, food, and all other essentials. So it gets quite easy to see how people will be struggling to keep themselves fed during this period. So the research identifies that the most immediate driver of low levels of income, and therefore the need for food banks, is the design of the social security system itself. So this can include aspects such as the level of the payment, or things such as the 5-week wait built into UC. But both before and during the pandemic, repaying advances is identified as a key factor in driving hardship here. So our report actually showed that in mid-2020, the DWP was the most common creditor for people referred to food banks, with 47% of households referred repaying money. And actually, when you focus in on universal credit itself, that jumps up to 73%. And this is most commonly down to the repaying of an advance payment. So if people aren't aware, there's a 5-week wait built into universal credit, but you can apply for an advance payment to get you through that period, but then that is deducted through your forthcoming payments, which leaves people often in a very difficult situation and often needing to go to a food bank for support. So sort of alongside that primary driver, the report also picks up on 2 background drivers, which can really compound those issues. The first of these is challenging life events or ill health. So about 3/4 of people referred to food banks in early 2020 experienced a challenging life experience in the previous year. And this is all the kind of stuff we often have, many of us in the session will have dealt with, supporting people in those points of crisis. But it just shows how much that can, when combined with other factors, leave you in a situation that you just can't recover from. The second background driver was a lack of local support for people. So people who lack support networks, or potentially who've exhausted them as well, are at an increased risk of needing food bank support. So during the lockdown, those who lost help from people previously supporting them were 67% more likely to need that support from the food bank. So it shows that that broader impact on people in society, everyone maybe having a little less income, left them less able to support friends and relatives that they may have been able to support previously. So just briefly running through then, so what the report is essentially calling for is a plan to end the need for food banks. So what we want is for the government at all levels to commit to ending the need for food banks and to develop a plan to do so. So for the UK government, this plan, we'd like to see a commitment to ensuring that the social security system provides everyone with enough to afford the essentials. So, from ensuring benefit payments are sufficient, accessible and responsive. And we think this starts with locking in that £20 uplift to UC and extending it to people on legacy benefits. We need to ensure that local lifelines are available to get people the right support at the right time. So what it comes down to here is early support to stop those short-term crises becoming long-term hardship. And that could take many different forms, but that needs to be a response to local need. And listening to people in those situations. We also want to see investment in cash-based grants and coordinated local support to prevent those crises. And we think this starts with a commitment to dedicated long-term funding for local welfare assistance across the UK or across England, to bring it in line with sort of Scotland and Wales. And also of vital importance is to include people with lived experience in shaping these plans. So what we really want to do is to harness the expertise and commitment of people involved in food provision and the people out there utilising food banks and other forms of food aid, and to use that to inform those policy decisions, and to make sure that any policy decisions are developed across government departments. You know, I think as both Carl and Amit mentioned, you know, food poverty does not only exist on its own, it's part of a much bigger picture, and we need to ensure that those solutions take that into account and are tackling it, and recognise that interconnected sort of nature of these issues. So that is a very quick whistle-stop tour of what actually is a very in-depth and long piece of research. So if you'd like to know more, I would encourage you to go to our website. I'll share some links in the chat later. There's full reports, technical reports, executive summaries, blog discussions, all kinds of different ways. I would recommend taking that opportunity to read some of that, because there's a lot of really useful information in there. But just to finish then, very briefly, just to say that the Trussel Trust, both as the charity ourselves and as our broader network, our vision is for a UK without the need for food banks. And sort of to that end, we launched a new strategy towards the end of last year named Together for Change. And within that, there are kind of 3 core areas of work which we will be doing, both again as a central organisation and as a network of food banks. So the first of those is around changing communities, and that's very much focused on tackling the kind of specific situational drivers of destitution and advocating for services and solutions locally. So things such as income maximisation. We know there are huge amounts of unclaimed benefit entitlements out there, and ensuring that those get to people who need them. Increasing support services such as debt advice, mental health support to get people through those initial crises, and ensuring that there is a really strong and growing evidence base that underpins any anti-poverty decisions. The second area is changing policy. So that's very much about tackling the systemic causes of poverty and helping to design policy that prevents destitution. So benefit system that provides sufficient support at the right time. So that's got to be key to that. We think there needs to be that cross-party support for all these things. And we are coordinating an APPG group on ending the need for food banks, so which we're always encouraging people to get involved in. And again, we really see the absolutely vital as to get people with that lived experience involved in informing and shaping these policies. So that's absolute key. And then finally, there's the changing minds element, which is very much about kind of trying to halt that widespread acceptance of food banks. So what we're seeing, we want to challenge is this idea that food banks are a natural part of society. We want people to be ashamed that they are there, as we all should be, and we should be taking that action to try and prevent the need for those in the future. So increasing the awareness of the structural causes of acute poverty, and just ensuring that they aren't, food banks and other forms of food aid are not seen as a long-term solution to poverty, because what they are is crisis management, and we can't forget that. So again, there's a lot more information on our policy, on our strategy on our website. I encourage you all to look at that. We've got various campaigns running at the moment, such as the Hunger Free Future campaign, which Amit mentioned. We've got an incredibly powerful poem, which was written by one of our food bank users, and I can share that in the chat as well. And I'd encourage you all to take a chance to listen to that. I thought about trying to share it today, but the idea of trying to get sound to work over Zoom filled me with fear, so I've avoided that. But that's it. And again, I'll share my email, and anyone more than welcome to get in touch with me. So thank you.
Thank you, Richard. Thank you, Amit. That actually concludes our presentations for today. I'd just like to say a really big thank you to our 2 guest presenters. So thank you very much. Some very, very sobering statistics and words heard from both of you, but also some very encouraging words of action as well. Both I know that are taking place and also for the future as well. So it's really good to hear and see that things are actually happening. And I don't think anybody can argue with one of Rich's slides that talks about the end of food banks. I think we all share that view as well, and that goal. I can't see any questions in the chat. I do apologise for some of the slides being small, and I will look into that with the team to make sure that doesn't happen again. No idea what happened there, but we will share all of the slides, and this is also recorded. So if there aren't any questions in the chat, I'm going to say thank you to everybody for attending today, and I hope you come back and you're looking forward to webinar number 5. Which will be, as far as I'm aware, Vasuda, at 2 p.m. Next Friday.
Yes, that's not next Friday, the Friday after, and Friday it's after. On child health, diet and child health. So that will be a good one. Yeah. Okay.
And I assume that that's available for people to actually sign up for now. Yeah.
Yes.
Great stuff. Okay. So I'd just like to say to everybody that's attended today, thank you, and have a great bank holiday weekend. And we will see you soon. Thank you, everybody.
Thank you. Thank you, Kyle. Thank you, Amit. Thank you, Richard.
Thanks all.
Thank you. Bye now.
Bye.